Okay, hello guys. We're going live. So we're going live today. Going to talk about job burnout. Trying to set up some few things before we start. Yeah, we've done this before, so we're gonna continue where we stopped from. Okay, we're gonna talk about job burnout, and it occurs. We know job burnout occurs in all sectors. Pardon, I'm trying to set up some few things before we start, okay? Trying to set up the Instagram, YouTube, and Facebook. So I think we are in. We're in. We're going on. So we're going on now live. Two, three, one. Okay. Hello, guys. Welcome to today's edition, today's live section. Today, we're going to talk about job burnout and its prevention, as you all know. I posted it some few days ago. So we're going to talk about job burnout. Pardon, because I'm streaming live from three different platforms. Streaming live on Facebook, live on our YouTube channel, and also Instagram. So please pardon my um, face if I move it to the other side. Pardon, okay? So we want to look at job burnout, and I know a lot of you have heard about it. A lot of you have encountered it in your day-to-day activities, and you might be asking, "What is job burnout, and how does it affect us?" First thing you have to know is that job burnout does not only occur to medical practitioners. Job burnout also happens to other sectors. But a research that's been carried out actually indicates or shows that people who care or people who give care to others are the ones who undergo the worst form of job burnout. Yeah. And sorry, I was checking something on the Instagram. So job burnout, even from the definition, it's made us to understand that it affects more. Like it has 30 to 40%. Okay, let me read out the statistics for you. According to RCN, which is the Royal College of Nursing, it said that the research carried out on 10,000 nurses shows that 62% of them contemplated on leaving their job, and 61% of them cited hectic schedules, and which hinders them from providing care. And also, 83% of them felt an increase in workload, and that has seen over 5,000 nurses resign from their work in the space of 3 years. That's Arusi and Royal College of Nursing. To tell you that job burnout occurs mostly in people that deliver care in the hospital. Like I said before, I'm streaming live on Facebook, on YouTube, and on Instagram. So please pardon me, okay? Because I might be having some technical issues, but I'm fine now, okay? So, like I rightfully said, RCN has already given us the statistics about job burnout, and it affects majorly the people in the medical field. And one thing you should know is that according to ICN code, that requires nurses to advocate for health promotion and safety of the patients, and also develop their own competency throughout their practice, and while being mindful of their own health, and also active participation and contribution of nursing research. And the last one, which is collaborate with others in health care team to promote health and safety of patients. Now, one question you should ask, or everybody should be asking, is how can a nurse who is experiencing job burnout actively participate in health promotion and provide quality care to the patient? That's one question you should ask. Another question is how can a nurse who is struggling with emotional exhaustion and depersonalization be able to cater for the emotional well-being of others when you're having a job burnout? This is an interactive live video, so if you can feel free to join and talk about it if you've experienced one before, which I know you have. Can feel free to request. I'll put you on the live video. So we're talking about job burnout, remember. So after I just defined or I just stated what the ICN International Code, International Council of Nurses said. So they said we are required to advocate for health promotion and safety of the patient. Now the question that popped up is how can a nurse who is experiencing job burnout participate in health promotion and provide good and quality care? That's the question which nobody has answered. And coming down to the country where I come from, in Nigeria, in 2012, research was carried out. That's back then. Research was carried out over 270 nurses, and they pointed out that things like hierarchy, bullying, interpersonal working relationship between nurses and doctors were the things that were bringing burnout to them. And these issues have not been tackled or have not been followed. And for you to understand the meaning of job burnout, let me just give you a definition which was given to us back then by Meslak. He said that job burnout is actually the final reaction that manifests as a result of chronic stressors from the job, characterized by three dimensions, which is cynicism, inefficacy, and emotional exhaustion. These three things are what um, comes together to make out or to cause job burnout. Okay, and for you to understand this more, there are two things which I would like you to look at, or a model which I would like you to look at, which is called job demand and job resource. It will help you understand this job burnout. So, what is job demand? Job demand are those things in which your job or your work requires you to do. You understand? Things like the psychological aspect of the work, the physical aspect, the workload, the time management issues, the job uncertainty, and work conflicts. Those are the things that your work requires you to do. That's job demand. Now, what is job resource? Job resource are those things which are put in place by the organization in order to make you or assist you in your work. Now, when job demand is higher than job resource, it results to job burnout. Do you understand? When what is demanded or what the workload you're experiencing is far much greater than the job resource in which you're getting. Job resource can be the salaries, the promotions, and all that. So when job demand is above the job resource, it results to job burnout. Okay, so that's why the job resource has to be equated with the job demand so that um, you can actively deliver care or do anything you want to do in your career or your profession. And going on, sorry, let me take a sip. Okay, going on, like I said, let's look at let's try to talk about the definition we gave. Remember, we talked about three good dimensions, which are cynicism, um, inefficacy, and emotional exhaustion. These three things, that's what combines together to bring about job burnout. Okay, these three things. Now, the first one which comes in is emotional exhaustion. Now, that's the more pronounced one actually. The more one of the aspects in which we see every time, the more pronounced aspect of job burnout, which is that's emotional exhaustion. Okay, and that consists of moodiness, frustration, agitation. That can cause or lead to inability for you to cope with the work or with the things you're doing. Emotional exhaustion, and that comes with almost all the work we do because you're caring for human beings. And one thing you should know that human beings are actually one of the hardest beings, or one of the hardest living being to control or to care for. Okay, because nothing is enough to care. So when a nurse is delivering a care and is not there is no desired outcome, the desired outcome is not coming, it leads to emotional exhaustion. Okay, so emotional exhaustion actually it negatively influences physical competence, your physical competence. So you just have to try your best to avoid emotional exhaustion. And talking about cynicism and depersonalization. Now, this comes from when you are trying to detach yourself from the work due to the workload, due to the incorporation you're getting with your work. You're trying to detach from the work, and that brings up, or that brought up about the quote of nobody is your friend at work. Go to work, do your work, get paid, and go home. That brought about a negative concept actually, because you're trying to detach yourself from work. You're trying to move away because you're no longer enjoying the work you're doing. The passion or the love in which you came into the work to do, you're no longer enjoying it. You're no longer feeling so happy about it. So that brings about the personalization. You want to move away from the work. And talking about inefficacy. Now, inefficacy is actually trying to explain, I think, is one of the most complex of job burnout, in the sense that there's this feeling of incompetency. There's this feeling of unworthiness in you, because you are not getting the desired outcome in which you want. Note the word desired. That means you've put up, or you've put in a lot of work for something or for a goal to be achieved, and is not being achieved. That leads to inefficacy. And that's one of the things that have been making nurses, or majorly most of the healthcare practitioners, to leave the work. Most of the healthcare practitioners to, look for other things to do than managing or caring for people. Sorry, like I said, I'm streaming on three platforms. Okay, so I'll be moving my eye, streaming on Facebook, Instagram, and on YouTube. Okay, so we we're going to look at some of the causes, some things that might cause, or some things that might lead to job burnout, and also possibly how to prevent most of them. And one of the things is personality traits. Some persons might have this personality trait of introvert, being an introvert person, not being able to speak up, not being able to communicate effectively. That increases the risks of you developing job burnout, because you cannot flow easily or communicate easily with others at work. You can't tell them how you feel. And you should know that effective communication is one of the most important tools in teamwork. So if you don't have it, that could lead to job burnout because you'll be on your own. That's true. And the next thing is management at all unit levels. Now, in some institutions or in some organizations, there's bad management. Yes, there is bad and poor management, which occurs. And one of the things to point out in those bad management is decision latitude. Now, decision latitude is actually trying to say when policies or laws are being made in absence of those who the law is being made for. People like the nurses who should be involved in the who should be involved in the decision making. They are not there. They're not present there, and decisions are being made. and it will affect them negatively. So decision latitude is also one of the curses of this job burnout. And also we have role conflict. Now, in role conflict, I posted a video actually, 2 days ago. Now, this that video stated a nurse was complaining that a patient ordered a food. I think it was curry chicken, a food online. So a patient ordered a food online, and the patient had to send the nurse to go pick up the food downstairs. I posted the video, and people were voicing their concerns. And I picked out one comment actually from my Instagram page. A certain lady, she said, although I'm not trying to overrule her comment or make it look senseless, actually. She said that I don't think there's anything wrong with that. I can go down and get the food for the patient. She said an example. She said her sister was once admitted in the hospital and she was the nurse there. She had to go down and get the food and all that. I smiled. I was like, wow, actually, we are making up problems for ourselves. We are cooking up problems for ourselves. Now, imagine if that policy or that thing is enacted into the nurses' role. Imagine if all patients start calling nurses to go and buy something or go and get a food I ordered downstairs. We are the ones that will still complain. The nurses are the ones that will still complain. Something, see, going down to go and get a food for a patient or going to buy a food is not a primary function of a nurse. Is not your primary functions. That's the we try to create more workload for ourselves. What if each if okay, what if in a country where we don't have online all those online vendors in some locations, that means a patient can legally call you, nurse, please come. Can you take this money? Go downstairs and go and buy me food. Are you kidding me? So that is very wrong. That's not a primary function of a nurse. You ordered food and you're instructing a nurse to go and get it. If you're ordering food, then you should be at home. Yeah. So workload, don't build up workloads for yourself. And if is enacted into the nurses code or things we should be doing, definitely it won't go with nurses. So please don't do that. And also trying to be a good nurse, trying to be the good nurse everyone is saying, it's very bad. Let me tell you something, or let me give you an example. I've been to a shift where that's a duty. I've been to a duty where they were assigning, the roles which we are going to take for the particular day. And they gave a particular nurse, they were like, nurse B, you are going to take care of patients in bay 1, bay 2, and bay 3 because we are lacking staffs. Some institutions make it as an option. They'll ask you, are you happy to take up bay 1, bay 2, bay 3? And those bays consist of several patients, like 4 to 5 patients. So they'll be like, are you happy to take up bay 1, bay 2? And the nurse said, I'm not happy to do that. I can't do that. But there are some nurses who will, in the name of, I want to answer a good nurse, I want to be the best, I want to receive awards, and you go and cook up and take up much workloads on your own. That's very bad, I must tell you. Let me also let you know that the research being carried out by ICN also showed that this thing, taking up much workload is actually one of the things, or one of the crucial things, that increases cross infection in hospitals. I know most of you don't know, but it's one of the things that, if you look at what is involved, let's take for example, you're taking care of a patient in bay 1, also in bay 2, and also in bay 3. These 3 patients, remember that each of them are zoned to what they come with. Some of them come with viral infections, you understand? So when you take care of 1, 2, 3, that's the spread of infection. You're contaminating the whole thing, no matter the aseptic procedures which you follow. Sometimes it could be emergency that you have to be in bay 1 when you were in bay 2, and you just rush in. So there is actually high risk of cross infection going on. So don't just take up work, and don't just take up, things on your own just to answer the good nurse. Always remember that that work or anything you're doing, any work you're doing, as even outside the medical field, any work you're doing actually will go on without you. Yes, it will definitely go on without you. So don't overload yourself trying to be the good nurse. Do the one you get. I'm not saying you should not do what you're supposed to do or what you're paid to do, please. So do the work you can do. Take care of the patients in which you are assigned to take care of, and that's that. Okay. And another thing that can cause job burnout is poor nurse physician relationship. I know in some countries, basically where I come from, also we have this loggerhead and these problems, or these how will I describe it? These superiority issues that occurs between doctors and nurses. Yes, it happens. So such things can lead to job burnouts in the area of the nurse and also the area of the doctors also, because no one will want to do something. Everybody will have this mindset of it's your work, it's your work, it's your work, stuffs like that. Okay, so it also increases the risks of having job burnout. And also lack of clinical supervisions, inadequate staffing. Like I said, inadequate staffing is one of the crucial things that leads to job burnout. um, when you should have a number of good staffs, the nurse patient ratio will be balanced if you have a good staff. But when you have a poor staffing, you notice that you have a nurse taking care of 9 patients, a nurse taking care of 8 patients, a nurse, just a human being. The thing is that most of these organizations sees human beings as robots. I'm not talking about nurses, only nurses. Now I'm talking about generally. Most organizations sees their workers as robots or objects that don't have human mind. Everybody is prone to mistakes. So you taking care of 8 patients could lead to many errors. And whenever these errors come up, nobody's going to ask you if you are overstaffed or understaffed. Your license will be at risk. Another thing I want to point out is not making use of the break time in which you have at work. Probably because you're working too much, you have so much patience and all that. That leads to job burnout also. I have a nurse actually. She's this kind of person that no matter the workload on each shift, she must take her break time serious. She must go and have a break time, and that's very crucial to every sector, not just the nursing sector. Take your break time serious. If you have a break time, go. There's no organization. I don't think there's any organization. Maybe you tell me in the comment sections. I've not seen any organization that will tell you that there is no break. There's always a break. It's just that you have so much to do and you are rushing to meet up with time and all that. You understand? So there's always a break time, maybe 10 minutes, 20 minutes, 30 minutes. Some go as high as 1 hour. Okay. So when you have such break, please do very well to take your breaks, rest your head, and come back to the work. Okay. And I think I won't dwell much on that. Let's talk about some of the preventions. I don't want to hold you too long to the video. Let's talk about some of the preventions of this job burnout, what we can do in order to prevent job burnout. If you have anything to say, just tap it on the comment section, or you can come live. I will permit you to say one or two things. That's fine. Okay. So one of the solutions, excuse me, let me take some sips. So one of the solutions in which one of the things that can help us to prevent job burnout is for us to develop effective communication. Effective communication is very important because it will help you to speak out, to speak up. And remember, I said effective communication is one of the basic tools in teamwork. In teamwork, yes, you have to. When I the first time I had to work on my own, like the first time I got a job back home in my country, when you come into a new environment, you feel isolated when people are talking, when other workers are talking. You feel very much isolated from it. And if you're not the type, if you're not the person that's that has this effective communication to relate to others very well, or to just to just to make you not feel isolated, if you don't have it, bet me your frustration starts that day, because you feel secluded, you feel much more away from everything that is happening. And another thing is nurse patient ratio. Now this particular nurse patient ratio, I'm not referring to the management factor. No, I'm referring to our you and I who is employed. Don't take up work or duties that you know that you cannot handle. Yeah, don't take them up. Don't want to be that good nurse. Don't have that mentality. So you want to take much more patience. You want to do more things, you understand, so that everybody will see that you're working very well. So don't do that. Don't overlabor yourself, please. And another thing is break time observations, which I stated earlier. You have to take your break times serious. Go for your break time. Another thing is what do you do after work? What do you do with your off duties? What do you do with them? One thing I've noticed with a few times I've worked in the UK is they don't joke with their weekends. Yes, even they might prefer a core British will prefer to have their off duties during the weekend, because they love their social life. They love to groove, they love party, they love their nightclubs, things like that. So all those things help. They integrate all those things in their social life, in all aspects of their life, in order to balance and your work and your social life. So it gets you going. It gets you going instantly. So what you do after work matters also. And we have proper diets. Yes, I know that some persons working in some organizations or institutions leave very early to work and come back late at night. And most especially, you eat junks at work. That does not help. That does not help actually. So you try and get proper dieting. Sometimes wake up early, cook, have things prepared which you take to work. Okay, so proper dieting is very very essential in order to prevent job burnout. And also we have good emotional management skills. Now it's not every of your emotional problem that should encroach into your work. Not all should encroach into your career or your profession. Yes, you can have an emotional breakdown in which you take some time off from duty, from work or from duty. Yes, but when you have a good emotional management skill, it will actually help you. It will actually help you in order to manage what you do, in order to give you a high output. So you have to have a good management skill. Manage your emotions very well, manage all you do very well. Okay, so it will help, or it will give you a desired outcome. Remember the issue of inefficacy when you start feeling incompetent on body. Okay, now another one is self-awareness and self-reflection. Now on self-awareness, I actually advise nurses to actually about your leave about your leave. You have to plan your leave very well in a year. We have 12 months, a 12 months in a year, right? Yeah, 12 months. Now, when you want to plan your leave, plan it because you know your body very well. You have to plan it in order that if I work from first month to 2 months to 3 months, I notice that I'm experiencing a job burnout. I have to take my leave. That's how you should plan your leave, not just my friend is going to have a birthday on so day, so I'm going to take my leave that period. That's not going to help you. Plan your leave according to how, like the extent in which you're going to work. You have to take a rest or a break from work. So you have to plan your leave properly. So that goes in self-awareness, okay, and also self-reflections. Now, when you're having issues with the personalization, when you feel that you are becoming detached from your work, you have to have self-reflections also. Know where you're not getting it right. Know the wrong things that you're doing. Know how to step up. Know how to cover the loopholes in which you're experiencing in any work you're doing. Okay, so I think with all this, it will help you to manage or to deal with job burnout. So I advise every one of you or every one of us to take this very serious. If you have something to add, you're free to come on the live video. If you have something to add, I can see Joanna. Okay, she wanna join. I'm adding her. I'm adding her. I'm adding her. I'm adding her to the live video. So I don't know if she's still there. I think she wants to join. She wants to join the live video. So adding her if she has anything to tell us, if she has experienced it before, and if there is any prevention strategy in which she can also give us. I don't know if she's still there. John, are you there? Okay, I don't think she's there. Okay. So let's continue. Okay. So, like I said, if you have any other thing to add or to comment, anything, just let me know. Drop it on the comment section. Okay. And I'll pick it up. We'll discuss about it, talk about it. Okay. So don't forget to like, don't forget to share, don't forget to subscribe to our YouTube channel. Yeah, share this video, like, and subscribe to our YouTube channel also. That will help us. So see you next time when we'll have something else to discuss. Okay. See you next time. Till then, take care. Bye.